Now, it's my distinct pleasure to introduce Dr. Jan Lowe.
Today I want to share with you, and they asked me to focus not so much on going into the details of the research that we've been doing over the years, but to really draw and present the lessons learned from the experience of integrating orange flesh sweet potato into nutrition and health interventions, and some thoughts on agriculture nutrition interventions for the future. So I will focus on those 2 points in this presentation. And first, I want to go back in time a little bit. I could have never imagined 20 years ago sitting in a room with people working on ag and nutrition. And what I'm excited about at this meeting is there's a whole new generation coming up thinking this is normal. Well, back then in 1995, it wasn't normal. And that's when I was doing my postdoctoral research and realized that the International Potato Center was sitting on a gold mine in sub-Saharan Africa. Most of the varieties, or the dominant varieties, are white-fleshed, having no beta-carotene. And it seemed a no-brainer that we had in the germplasm bank varieties that are very rich in beta-carotene. And just 125 grams of a boiled root meets the daily vitamin A needs of a young child. And even now in the continent, they estimate that 48% of children under 5 are vitamin A deficient. So most of you know about vitamin A, how essential it is for a strong immune system and good eyesight. Animal sources are expensive, and sweet potato is widely grown in sub-Saharan Africa, and particularly in East and Southern Africa, women dominate in its production. So the idea in 1995 was think we could make a marginal change in the food system that could lead to a major change in human health. But where do you start? And this is a fairly very widely used diagram. And as you all know, nutrition is influenced by many factors. It's very complicated in terms of you have the health dimension, illness that can influence absorption. You have the whole food system coming online here that influences supplies and ability to store and utilize. And so how do you move in such a complex system and start to do this kind of integrated work? And so back then, in the late 1990s, we came what I call moving from an impact pathway to an implementable pathway, because you're dealing in a very complex system. You know, where can we focus and make a difference in terms of this? And there's been 2 models we've worked with quite a bit over the years. And the one model I would call the agriculture, nutrition, and marketing model, where you have these 3 intervention points. Obviously, we're introducing and promoting the use of quality planting material of the orange flesh sweet potato. And that's got to be, in a sense, done with a variety that's competitive with the local varieties in the area. And that's going to increase our supply of beta-carotene and energy. And I should mention many other vitamins and minerals in the diet, because all sweet potatoes have good levels of vitamin C, K, and E, and many B vitamins, and several minerals. So it really is a quality food. And then we feel very strongly that you have the nutrition component, which is demand creation and empowerment through knowledge. And this has been mostly focused at the community level behavioral change, but also media level promotion activities to increase knowledge and demand for vitamin A-rich foods, which helps lead to increased intakes in vitamin A and energy, but also these activities support the marketing component. And increasingly, you know, when it takes more time, but we think a very essential component also is the market development for roots, and we're increasingly focused on also developing processed product markets, particularly for urban areas. And, you know, the market component really helps us, I think, accelerate uptake of the orange flesh sweet potato but it also helps us, I think, get more permanent adoption of the technology. Because in many countries, I think we found that women may be responsible for cultivating the sweet potato, but often men are determining the amount of land allocated to the crop. So if there's a marketing component, you tend to get more male buy-in and increased access to that land. But we also know it's a question of time. Developing that marketing component takes more time to put in place and get functioning than just doing a nutrition outcome-focused intervention. And all of these, especially the first two pathways, link together, and we would like to see impact on a vitamin A indicator like increased serum retinol levels. The second model that we've worked with is what we call the Momma Sasha study, which was something done between 2010 to 2014. And this was an integrated agriculture, nutrition, health intervention where we were in Western Kenya. We worked to integrate better nutrition education into health services for pregnant women, particularly the counseling services. And linked to that service at the health clinic and health facilities were the issuing of vouchers so people could obtain sweet potato vines from community multipliers in the area. Then they'd redeem the vouchers from the trained multipliers, and we also encouraged women to enroll in monthly pregnant women's clubs where the nutrition messages would be reinforced, and there would be additional activities like cooking demonstrations to really get more improved porridges and child feeding practices instilled for behavioral change. And there was backstopping also on the agricultural extension activities to improve the output of the orange flesh sweet potato. In this one, there was not a marketing component. So, based on all this work, there's been a number of studies that have come out, and there's several of you in the audience from IFPRI and Emory University that have been involved in this work. Feeding trials done in South Africa, the community-led intervention that was done in Mozambique, as my second home, as John has said. Then the Reaching End Users Project, which reached 24,000 households in Uganda and Mozambique, that was led by Harvest Plus, and the Momma Sasha study that I just mentioned, which focused on pregnant women and children in the first 1,000 days. And this research has proven that beta-carotene in orange flesh sweet potato is bioavailable, and we've seen really significant increases in vitamin A intakes, and sweet potato is a part of that increase, and an important part of that increase in intakes. And we have evidence that it's improved the vitamin A status of young children, as well as in the Momma Sasha study of women who are taking care of those children. So in terms of key lessons learned, we've been working with these models now, and clearly, in an agricultural intervention, one of the challenges that we've had to face is really having to engage in breeding in Africa for Africa. Because why we had the beta-carotene trait, we really had to breed with local varieties to get the characteristics, both the drought resistance and the virus resistance. But most critically, we had to raise the dry matter content in the varieties, because in Africa, in contrast to the United States, adult consumers prefer varieties that we say are flowery or mealy in texture and often have dry matter contents above 28%, compared to the United States or Europe, where we like varieties at 21 or 22%. And we had a bit of a conflict because the young children love the low dry matter varieties as well, because they're very easy to swallow. A lot of the high dry matter varieties, you need to take it with a cup of tea. So children easily take to the OFSP, they love the color, and it's been a process, and now we do have, over the last 5 years, there have been over 70 improved orange flesh sweet potato varieties released that have been bred in 9 sub-Saharan African countries. So with every cycle of breeding, we get better, and we really have a whole different range of varieties to draw on now that we didn't have 15 years ago. We have found through the REU study and others that 1 year of group-level nutrition education gets OFSP integrated into the young child diet. We have learned that some practices associated with the nutrition education programs are easier to change than others. For example, feeding frequency we've been able to increase, using the first milk, the colostrum. I think the timing of the introduction of complementary foods. Other things have been extremely difficult to change. Tradition in many cultures that we work in gives some kind of water or tea or herbal substance during the first few days of life. That's part of tradition. That's hard to stop. People want to stop breastfeeding when they turn pregnant. That's, again, a tradition that's hard to change. Boiling water, forget it. You have to find out some other ways of getting water clean. And purchasing nutrient-rich foods. In the model we had before, we thought, well, if people sell their sweet potato, they'll buy other nutrient-rich foods. But in the poor countries that we work in, we found, nope, it was being spent on sugar, oil, salt, school fees. And they said, well, we can grow the vitamin A-rich food. Why would we go out and purchase more vitamin A-rich foods? Because they have so many needs with that limited cash income that they had. So that part of the model didn't really work out. We also have learned the importance of engaging with what we call the influencers, the husbands and the mothers-in-law that influence behavioral change at the household level. We've done a lot on demand creation, not just in our clothes, but in everything we do. And I think that's really important that we've learned about marketing for health and marketing for good nutrition. And we recognize that a lot of the media is awareness creation. It alone probably won't get your behavioral change, but it opens up market opportunities as well as informing people that the orange colors and the green colors can be associated with healthy foods. We've had to focus a lot on image change. In many countries, because it is a resilient crop, and it's the crop that is there when the maize fails, it's also seen as a crop of the poor. So we've really had to work on using the orange flesh sweet potato as saying it's a healthy food for all classes of people. So sometimes we actually target working with better off consumers because they influence the image of the orange flesh sweet potato. We've worked a lot on identifying and training and had special efforts to develop local advocates and engage with officials, to work together with other partners to get really biofortification in a broader sense into policy documents and planning. The essential role of community health workers keeps emerging in all the work we do. And part of this gets back down to the seeing is believing. The demonstrations, the things you do with food have been very effective. I think the peer support is important as well. And critical for getting real impact on, particularly on the biological outcomes, is assuring adequate participation in activities. Somebody else mentioned that this afternoon. You know, how do you get people to fully participate? And we found that that intensity of participation is important for actually making those changes in dietary practice. But poor people are busy and they have a lot going on. One way is keeping them motivated by that marketing component. And sometimes for the men, we would have separate groups and call it agricultural training, not nutrition training, but bring in the nutrition. In terms of quality, keeping that quality of messaging is critical, and we've had a lot of variation that's based on what we can do with that on the kinds of extension personnel you can hire in terms of their levels of formal education, and really the level of education you can find in your community promoters and volunteers that help you go to scale. Job tools are well-designed job tools are critical for reminding the extension personnel of what the key messages are, and we have found that fairly frequently refresh trainings are necessary and essential for maintaining the quality of the work. Most of our work in different countries have indicated that the same volunteers are effective for about 2 years. So that means you have a reinvestment of identifying and training new community volunteers. And what we're struggling with, and I think we're all struggling with, is the cost per direct beneficiary, and these kinds of interventions can be high, which is one of the reasons I'm on the economic evaluation group, because we have to come up with better ways of describing the multiple benefits of these interventions so governments start believing in investing in community-level nutrition education. There's limited public sector investment in extension in many of our countries, and that presents us with a particular challenge of how do we go to scale. In 2009, based on support we got from a number of donors, and in particularly from the Bill and Melinda Gates Foundation, but also DFID, USAID, and Irish Aid, we were able to launch the Sweet Potato for Profit and Health Initiative. And this is a vision of trying to take what we've done in research and begin moving it to scale with multiple partners. So we see it as a multi-partner, multi-donor initiative that seeks to reduce child undernutrition and improve smallholder incomes in 10 million African families by 2020 through the effective production and expanded use of sweet potato. And then I manage the research project that underpins that, where we keep breeding for better varieties with 14 African countries and solving what I consider to be still the remaining bottlenecks in the research concerning seed systems, crop management, and post-harvest management. So research must keep on going, why we are really learning about going to scale. So we launched this to reach 10 million. We're currently at 4.5 million households reached. So we still have a ways to go, but we're learning a lot and adjusting along the way. So lessons learned on scaling. You know, as we all know in this room, proof of concept is just the first step. And we've developed tools like investment guides that are on our knowledge portal, sweetpotatoknowledge.org, that any organization can download that gives them guidelines on how to design an integrated ag nutrition marketing intervention. But every country has its cultural context and agroecological conditions and their institutional strengths. So you do have to adopt and adapt in every new situation you go into. So a period of formative research is critical for getting something off the ground in a new setting, and during that time, we often bring in what we think will be 6 to 8 varieties that would be best for that particular area, and see if it matches with the consumer preferences in that area. So that gives you that year to really design and adapt. What we have is, I think, a very good generic model to the specific situation. And like I said, we have briefs and guides on investment and implementation, and we have worked with 3 countries to design and institutionalize a 10-day trainer of trainers course in Mozambique, Tanzania, and in Nigeria, and it's also been run a couple of times in Ghana, and it's in Burkina Faso. It's also being run in Ethiopia. So again, on our knowledge portal, you have the manuals for 17 different modules on everything you wanted to know about sweet potato in 5 different languages: Portuguese, French, English, Amharic, and Kiswahili. So partnerships, we have found, have been essential for going to scale, but communication is really core, and defining roles at the beginning of any intervention, particularly important. You can only control, in a sense, your partners to a certain degree when you have control over the funding. And otherwise, you're getting people to collaborate, communicate, share information because everybody has their different ways of monitoring what their activities are, and the relative importance of sweet potato in their intervention varies from partner to partner. We try and keep communication between the partners healthy using our Partnership Health Checkup tool, which basically asks 10 simple questions of people involved in the project, and then we have sort of facilitated sessions to say what's going right, how is our communication moving in the project to keep the process moving forward between partners. And I think the biggest challenge you face is when you start going to scale to larger numbers, how do you sustain the quality of the intervention at scale? How do you make sure that the extension people are giving out the good messages and the correct messages, and that questions that are coming up are being correctly addressed by the agronomists, et cetera? So now some thoughts on the way forward. We've learned a lot, we're learning more. I guess some thoughts I have. I know there's a great focus on the first 1,000 days, but I believe very strongly that the children of today are the parents of tomorrow. And as we look at the cost of going to scale, I'm much more interested now in using schools. Because as we see, not every country has extension personnel, but every country has schools throughout the country. And when you think about it, those most at risk of poverty and malnutrition are those who don't complete primary or secondary school. So to me, nutritional knowledge, and in some cases basic agricultural skills, should be considered life skills that should be fully integrated into the school curricula. And in some cases it makes sense, or it's possible to even build in school gardens, but with efforts to increase the availability of seed going back to households from those gardens. We've had a good experience integrating orange/sweet potato into a school feeding program in Osun State in Nigeria, but I recognize that the scope for that expansion, though it's been very successful in that case, is limited because of the limited number of school feeding programs that are out there and really can be built on. And then some thoughts on the way forward. In terms of let food be thy medicine, I think integrating nutrition counseling as a core module in training of both doctors and nurses, you think that would happen, but actually you'd be amazed in how many countries nurses and doctors aren't given basic nutrition training. And that should be, we shouldn't have to introduce it into ANC services. It should be a core part of antenatal care services. And I think we still need to provide more evidence to governments that return on investment in community-based nutrition intervention is positive, and then it's much less costly for us to integrate biofortified crops and other nutrient-rich crops into those community interventions if that community-based nutrition system is in place. I think government does have a major role to play regarding regulation to control unhealthy food promotion. And over the last 15 years, I've watched the rise of Indomie in West Africa. I think it's a frightening food. Nigeria now is the 12th largest producer of instant noodles in the world. And you can see they have right on the packaging there, tasty nutrition, good for you, and you drive through the country and see every primary school painted with this message. Talk about ultra-processed foods we should not be encouraging. So we are at this transition point, moving into mixed food systems, and I think government awareness of the choices they need to be making and who they should be taxing to pay for nutrition education programs is becoming obvious in my mind. Other thoughts on the way forward, promote production diversity in rural areas with poor market access. There have been a number of review studies lately, and there is mixed evidence on the degree to which production diversity increases diet diversity, and it tends to be most positive when people do have poor market access. And in other cases, when there is good market access, it may be more efficient to raise dietary diversity through a market-based approach as opposed to introducing new foods. But it is all of a question of productivity, price, and availability. And promoted foods must be relatively easy to produce or easy to sell to really take off in some of these our poorest settings. So the introduced nutrition foods and feeds must fit in terms of competitive land use. And of course, in East and Central Africa and Southern Africa, we're to see declining land per capita availability of land, and particularly the good land. And of course, sweet potato fits very well in there because you get high energy output per unit area per unit time. Most of our varieties now are mature in 4 months, and we have a whole subset that's mature in 3 months. We're also promoting the use of nutritious ingredients, our nutritious crops as ingredients in processed foods. Now, this can get controversial if I'm talking to a pure nutrition community. They say, okay, yes, it is great to eat it roasted or boiled or steamed, that is the best. But let's face it, urban consumers do want convenient foods, and there's a lot of people in sub-Saharan Africa eating bread. So if we can replace 30 to 60% of that wheat flour with orange flesh sweet potato, we're creating markets for farmers and making a healthier food. I'm not going to say in all cases it's healthy, but it's healthier. And so I make that distinction because we do want opportunities and markets, and we are recognizing that the continent is urbanizing quite quickly. We need to invest, and we have invested with support from our donors, in laboratories for nutrition analysis and food safety assessment, and promote the use of accurate labels. And we need to encourage private sector companies to market nutritious foods like powdered milk and small packets and things that people can afford, and that's already happening. Finally, we must improve the productivity of nutritious foods and their storage to have affordable nutritious foods. I think several presentations during this meeting have pointed out, and we've seen, that the productivity gains in fruits and vegetables in comparison to grain crops has been low in the past decade. So there needs to be research investment in getting the productivity of fruits and vegetables up to help drive the price down. An 18-country study I came across recently showed that to eat 2 servings of fruits and 3 servings of vegetables per day per individual, it would cost 52% of household income in low-income countries. Well, it's clear why people aren't eating more fruits and vegetables. You have the preference issue and the tradition issue, but you also, most importantly, have the cost issue. Reducing transport costs and post-harvest losses is critical for perishable crops, and sweet potato it lasts for 2 to 3 weeks outside the ground, but with storage can go up to a year. And clearly the fruits and vegetables have more problems with perishability. I came across a very interesting look in India where the investment in cold storage in Uttar Pradesh tripled potato production over the past 15 years. So there are very straightforward and known things that can be done, and of course that was done with the help of government subsidies recognizing that cold storage needed some support. So improving storage technologies, drying and storing capacity at the household level, I think would be key in this arena of ag nutrition. So thank you for your attention. I guess everybody says, why do you focus so much on an orange flesh sweet potato? But I said, there are no magic bullets. As you can see, it's an integrated approach to get diet diversity going, and we just have an easy entry point with a crop that can truly make a difference, and the crop that is easy to grow by poor households. But I think with commitment and leadership, there is a clear way forward. We have the next generation coming up. And I was very pleased to learn 2 days ago that we have 2 leaders of nutrition that have just been awarded the World Food Prize for 2018. So please join me in congratulating Lawrence Haddad, who I'm sure you all know, and David Navarro, because nutrition is at the forefront of agriculture now. Thank you.
And there is this problem, let me talk about Ghana, with seasonal production of potatoes. You don't get it on the market every time. So people then would not be able to sustain the consumption of potato throughout the year. Have you come up with remedies that are easy to apply for farmers to be able to manage post-harvest losses by keeping the potatoes over the year? So I have a year-long production of potato so that I can increase the consumption rate by parents.
Yes, seasonal availability is a concern, and what we're suggesting depends on the environment. In some environments with longer planting seasons, we encourage people to stagger plant. You don't have to plant your sweet potatoes all at the same time. It's much more flexible than maize in planting times and still getting decent yields. The other thing we've come up with, because it's a particular problem, you know, in areas like parts of Uganda, Rwanda, and Burundi, they can just plant year-round because of the bimodal rainy seasons. But in unimodal areas, it's been quite an issue. So our research has developed a method called Triple S, which is storage in sand and sprouting. So instead of trying to struggle to keep your sweet potato alive, you put it in layers of cool sand and roots, and these should be healthy roots that haven't been cut. And we've been able to push this storage up at the household level to 7 months. And so it's a technique that we're taking to scale now under a scaling opportunity, and it's proved very effective in these areas that are have the most difficulty maintaining the supply. We started it out as a seed technology, but then we said, well, we can do the same thing with bigger roots for consumption. Why not? So it's still the same principle. We call it the sandbox principle, and you can build a little sandbox in your hut and go in and put layers of bigger sweet potatoes and then eat them, and we've been keeping that sandbox going for 4 to 6 months. So it's where we're struggling is on the commercial level storage, because obviously in the United States and Europe they have large warehouses with cool storage, and we're developing in collaboration with the Natural Resources Institute solar-powered storage. I would say right now we aren't there yet, and the initial capital cost is still quite high. But I think for sub-Saharan Africa, given the cost of our electricity and the fact that it's so unreliable, we have to go towards other ways of providing energy for those cool storage facilities. So we're quite working on the seasonality issue, and those are the major things we're promoting right now: storage and staggered planting.
My question is related to the school feeding program. So are you planning the school to grow the orange flesh sweet potato as a supply, or are you planning them to purchase as one ingredient for the school feeding? If it is purchasing, how do you see the supply issue? And do you have also integrated way to advise them to improve the other food ingredient for the school feeding program?
Yes, in the case of Oshun, it's a very well-designed school feeding program in the sense that the money goes directly to the caterers, and the caterers buy the food on the local market. Now, we were starting with a new crop that's not on the local market yet. So in that sense, we set up people who are producing the orange flesh sweet potato, and they call the caterers and they negotiate and they deliver directly to the school. But obviously in the future, the ideal would be that it would be on the market and the caterers could buy it just directly on the market. We do work with the schools in designing the porages, because the challenge of school feeding is they have to keep the unit cost pretty low. But, I know in Nigeria they're integrating it with some small fish and other ingredients that go in that particular school feeding program. So I think it's very difficult to have the schools grow the food. One, they wouldn't get enough, and two, they often are located in areas that don't have good agricultural growing conditions, but nearby farmers.
Thanks very much for all of you today. It's been a real engaging day.